self-love and acceptance, which is very important, because unless you love yourself, you cannot accept love from another person and you cannot give love for another person.
Good morning, ma'am. I have Dr. Sitalakshmi. I have no clue how to introduce her. She's a YouTuber, she's a gynecologist, she's a sexual medicine practitioner. I think she have more than 1.3 million subscribers. And I had a patient, and they did not have, they were unconsummated married for 6 years, and they came to me and they told right now they are having good sexual intercourse. And I asked them how did they do that. They told they have attended a course in with Dr. Sitalakshmi. And we are eagerly waiting to know about that, and I think that is going to be the topic today. Thank you, ma'am. Welcome.
A very good morning to everyone. I'm Dr. Sitalakshmi, and it's my pleasure to be here in this August gathering. Dr. Rajani has just now spoken about the diagnostic aspects of vaginismus. Dr. Uma Shukla has also spoken many aspects of it. So now let me straight away go into the treatment aspects of vaginismus, especially the novel, unique method which we have developed in our center over the past 2 years. And I'm pretty excited to share all this with all of you. And I thank the organizers of this association for giving me an opportunity to do so. So I plan to touch upon how we managed vaginismus before and during COVID time, my initial admission therapy, the evolution and current status of Dr. Sita's batch therapy, that's the current therapy that we do, some audio and video pictorial testimonials, and the statistical data related to our work. So during COVID time, that is during and before COVID time, I have seen around 150 to 200 women with moderate to severe vaginismus. Most of my patients back then and now come after watching the related videos in my YouTube channel, Dr. Sita's Mind Body Care, which currently has more than 1.3 million subscribers. So at that time, I managed them using a series of thigh exercises, pelvic floor therapy, fingering and dilators, along with some suggestions for foreplay. The treatment was given on an OP basis in around 5 to 7 sittings, and the duration was anywhere between 10 weeks to 5 months. Now, what was the success rate? I'm not very sure about that. It might have been around 50 to 60%, I guess. I had not kept a tab on it at that time. Many patients did not follow up after a couple of sittings due to various reasons, and many might not have felt the intimacy and drive to follow my suggestions. And not all couples reported back their success also. But I was very, very happy because at least I was getting 50 to 60% success rate. I was very happy. Then what happened? My initial admission therapy happened. My talk would be incomplete if I do not share with you about the initial couple who changed the trajectory of my life and my experience with them. I'm sure you're all ready to listen to that. Aren't you? Yes? Why the whole hall is sleeping, I think. Come on, yes? Yes, there we go. So in mid-2022, a staff nurse couple from UK, Raju and Deepa, of course their names have been changed, married since 5 years, vaginismus confirmed as per history, and they have tried several treatment methods both in UK and in India. They had PCOS and other issues also, absolutely no libido, zero foreplay. They were on 4 weeks leave in India, wanted admission therapy while they were here to cure their vaginismus. So I was like, I was aghast, I was unsure if such severe vaginismus that they had could be managed in such a short time. And I tried my level best to dissuade them, citing numerous excuses about my health, this, that, etc. I don't want to bore you with the details of all that, but despite my concerns, the couple insisted that they want treatment from me and only me. And then finally, I decided to take on the challenge, and with a sigh started reading and planning as to do what for them. I read a lot. I made notes. 1 minute. I made notes. At that time, I did not have much contact with the very eminent sexologist sitting in this conference. And I knew only Dr. Neelima, and even she did not know what advices to give me for an in-house management. Anyway, by the time Raju and Deepa arrived, I had after ulcers in my mouth and I was looking haggard due to sleepless nights. So they told me I am their last chance and that they trusted that I'll be able to solve their issues. That made me more nervous as the responsibility was huge, you know. And I was very transparent with them. I told them my situation. I told them, I don't know what to do with you for the next 2 to 3 weeks. What I'm going to do with you, I need to do something for the amount you're paying and I need to make sure that you are successful also. So they reassured me and I reassured them. And we even did breathing exercise together, you know. All of us used to do breathing exercises together. But to my amazement and to their surprise, but they were not amazed because they told me that they were confident that they'll be able to progress with my help, but I was not very sure of myself. But anyway, by the end of 1 week, they had made significant progress in doing sensate focus exercises, fingering and thigh exercises. And both parties now became confident of success. All three of us started to enjoy our daily discussions where I gave them many tips to improve other aspects of their relationship too. Because by the end of 5 years, you know, the relationship starts getting sore in many ways. Because the wife tells something, the husband understands something, and that is lots of misunderstandings and lots of fights were going on, you know. And Raju and Deepa motivated the other patients too, who were consulting me during the time period they were there. That is, I told you, no, on OP basis, I had many patients coming in. So they motivated the other patients too. And many couples also wanted admission. But I was skeptical if I could replicate the results with everyone. And so I discouraged them at that time. Anyways, Raju and Deepa could successfully consummate on the 17th day of treatment. And our entire clinic rejoiced. And in the next 2 months, 3 more patients got admitted and successfully completed their treatment. The first couple was the first and last one that I allowed for partial admission therapy, as it was very tough to teach them everything in such a short time. They were there only for 6 days because they had come from Japan. They are Malayali couples, come from Japan. They took 3 online, that is OP consultations, and then they had only 6 days leave before they left for Japan. So they wanted to get admitted for 6 days. My God, it was a struggle. I'll never do that again. The second one was a relatively uncomplicated case, and the third couple had both vaginismus and erectile issues, primary erectile dysfunction, and it was very challenging. But then that couple had been with me for 1 year. They were attending they had attended some 6 to 7 sessions, you know, one-to-one sessions, but then they were having so many issues in their home due to health issues of this, that, and so many other issues. So they also wanted admission, and though it was challenging, finally we could achieve success on day 20, and my confidence grew. In addition to helping them to have a healthy sexual life, we were trying to improve their overall relationship dynamics also, which is very important. And these days we find that the relationship in a marriage is not as good as it used to be in the good olden days, maybe during our grandparents' time. So I think everyone wants a personal space. They don't want to talk much. They don't want to communicate much. There is so much of conflict management, so much of ego issues. The marriage is not important. The individual is important. That's what is happening these days. So with whatever limited knowledge I have, I tried to educate them. From the mistakes we had in our life, from the things which I learned through various courses, through various books, I taught them. And word spread, and soon more couples sought admission, eager for the same transformative experience. Around 6 to 7 couples were waiting to get admitted as soon as we could accommodate them. And then my husband told me, so look, now we will convert a part of the hospital into rooms, so that is rooms sufficient enough so that we can admit patients in batches. So due to the increasing demand and long waiting periods, that's why we decided to start the batch therapy. So initially, it was to reduce the waiting period that we started taking patients in batches. But then we soon realized that the batch therapy was the most effective form of treatment. The interactions and support within the group became the crux of our treatment. And the first batch was in December 2022 with 7 couples. And currently, we take in only a maximum of 8 couples per batch, and the minimum number is 4. We have already finished 82 couples, and another 50 couples are waiting. So we have got a huge waiting list now. You know, so I don't know how to manage it. So let's see, things will evolve. So we have a small hospital. See, this is a hospital building. I do not have good pictures, so probably we are going to paint the hospital maybe in the next year, and then maybe in the next conference I can show you better pictures. So we have a small hospital where we were doing mainly obstetrics and gynec, etc. I stopped doing everything, modified 10 rooms to suit the purpose of couple therapy on the first floor, where the couples have privacy and they feel safe and supported. That is very, very important, you know, when a couple who feel that they are not able to do the basic thing, even animals do intercourse. How we are not able to do it, why we are not able to do it. People are looking at us in such a non-judgmental and in such a judgmental way. That is their feeling. They feel so ashamed of themselves. So they feel supported and safe. It's very important to provide them with a safe and supported environment where they feel respected and non-judgmental also. So we try to provide them with such an atmosphere, and currently we too live on the first floor itself. And from December 22nd, 2022 to August 2024, we have had 13 batches and 82 couples who have taken in our inpatient batch therapy. And we have more than, as I told you before, we have more than 50 couples who are waiting for admission in the next 6 to 8 months. So the average duration of our treatment is 16 to 17 days, and success rate at the time of discharge has been consistently 100%. And you can know about the ongoing success and also about how many couples had vaginismus as their primary issue when I present the data in a while, after a couple of slides. So how can we, or rather, how do we guarantee 100% success at the time of discharge? Careful selection of couples is very, very important, you know. Sexual intimacy cannot happen as a standalone form of intimacy, and striving to focus on improving sexual intimacy alone is not at all enough. That is the thing that all of us need to understand, those who are practicing sexual medicine. So initial consultations and management is very important. So before accepting patients with moderate and severe vaginismus for inpatient therapy, detailed history taking is done. Admission is planned 2 to 4 months in advance, sometimes even earlier, you know, as we have a long waiting list, as I told you. And necessary investigations are done according to the couple and patient profile. Uncontrolled diabetes, hypertension, obesity, arthritis, back pain, thyroid issues, etc. and other physical comorbidities in either or both the partners which can interfere with the sexual functioning are managed to a reasonable extent before we take them in. And also, people who are severely anxious or depressed or who have other mental health issues or are still holding on to past trauma, if any, are given medications, counseling, therapies as is warranted. If there are severe relationship issues, we take in such couples only after they are addressed, at least to some extent. And before admissions, nutraceuticals, aphrodisiacs, vitamins, etc. are given. Some really help and some have just placebo effect. And medications are given as needed to ensure that the woman doesn't get a period during the treatment time. You know, we have to take care of such small things also. Because imagine a couple coming for admission treatment and then the woman gets a period. And most of the exercises we are not able to do because she has got bleeding. So we have to take care of such minor things also. So medications are given for that. And then a group call is conducted to introduce the batchmates to each other 1 month in advance. And it's conducted online, and after that a WhatsApp group is formed which includes my husband also. I am not on phone most of the time, so my husband only coordinates everything. He's there in this audience, so I'll make him come to the stage later, okay? So, and this WhatsApp group, you know, this helps the couples to get familiar with each other, so much so that on the first day of admission itself, they behave as if they are long lost friends. And chance to network or communicate with seniors is given to each and every patient. Seniors matlab, those who have taken treatment before, you know, which is reassuring and motivating to the couple. And none of the patients so far have refused to communicate or to reassure or to motivate new patients. None of them have refused. Not even a single couple have refused. And I think that is one of our USP, you know. because many people do that, they don't, especially when talking about such a stigmatous condition, many people do that. So that is something, that is a blessing that we have. And after admission, almost all the exercises have to be done by both the partners, which is very important. We have structured the exercises in such a way that almost all of them have to be done by both partners. Of course, that is insertion of finger into the vagina, a man cannot do because a man doesn't have vagina. Okay, but other than that, most of the exercises are done by both partners or with one helping the other. So the wife feels supported, motivated, and results are quicker and more permanent. That's what we have realized. And so the principles underlying our treatment are mainly the following. Self-love and acceptance, which is very important, because unless you love yourself, you cannot accept love from another person and you cannot give love for another person. Don't you all agree with me? Yes or no? Yes, and that's what most of us fail to do. We fail to love ourselves. We fail to be, we are too very critical of ourselves, of our body, of our mind, of whatever. So self-love and acceptance is the first thing we try to teach them. Partner love and acceptance, building up stamina and flexibility, eating and sleeping properly, improving mental and emotional health, learning relationship skills, sex education, improving sexual intimacy, herbal supplements, nutraceuticals and medications as needed. So, according to these principles, we do the following, as I'm going to show you, to ensure our success. The list is here. I'm not going to just read down the list because I'll give a short description of each of these. 1 minute, sorry. Yeah, psychosexual education involves educating individuals and couples about sexual health, anatomy, and the psychological aspects of sexual function, because the sexual response cycle in a male and female are different. So we have to teach them the psychological aspects, anatomical aspects, physiological aspects, everything. And this can alleviate the anxiety, fear, and misconceptions associated with vaginismus. We do it on an almost daily basis. And it's amazing that after 3 to 4 days or even earlier in these recent batches, they are open to having the discussions together rather than having a ladies only or gents only session. So I asked them whether you want a ladies only session for discussing some intimate discussions. They say no, we will have the discussion together only. So I think that is a lot of progress that we could make, And sensate focus therapy, as you all know, developed by Masters and Johnsons, is particularly effective in treating vaginismus. As with any other therapy, the effectiveness of sensate focus for vaginismus depends upon the commitment of partners and also the guidance of a skilled therapist. I'm not going to go into the details of sensate focus therapy, as experts here will be talking about all that in great detail here at the conference, and many of them have already been talked about. Just know that different types of touch should be done. And the man here, as you see here, the arrow pointing, So he's one of our patients. He had slept off holding the peacock feather while doing the self-sensate. And his wife posted this picture in the group, and I'm showing it here with their permission, even though the face is blurred. So, as the couples are here only for 2 to 3 weeks, I have made modifications to the sensate focus therapy to suit the purpose. And they progress from 1, 2, 3, 4, and then to 5, all within a span of 15 to 20 days, mostly within a span of 13 to 14 days itself. I'm not going to read out everything here due to lack of time, but all of you can check in the WhatsApp group, that is of our conference group, where I've already posted this slide prior to my talk. Our staff are well trained in teaching the couples pelvic floor therapy. The husbands are also instructed to do this, as it can help them to get better erection and also to reduce premature ejaculation. Specific yoga exercises and thigh exercises can help stretch and relax the pelvic region, thighs, lower back, etc., and helps to improve flexibility and reducing muscle tension. All that is very important, for addressing not only for vaginismus. Just imagine if a patient doesn't have vaginismus and no erectile dysfunction, but when they're having sex, suddenly the man develops a back pain or the woman has a thigh spasm, so the entire pleasure is gone, So we teach them all those things. We have daily morning yoga sessions from 6:30 to 8 a.m. every day we have, and the patients love the Shavasana or Yoga Nidra part at the end the most. The instructions given during the Yoga Nidra are tailored to suit the purpose for which the clients are here at our center. And my husband, Dr. Ramachandran, see, you can see him here, and he's the one who guides them for the Yoga and Yoga Nidra. And all the patients absolutely adore him. They come to the hospital after seeing my videos and taking my consultation, but when they leave, no, they are all fans of my husband more than me. That is something, sometimes it irritates me, you know. And then systematic desensitization is very important. It involves gradual exposure to the feared stimulus. I'm sure that most of you know about this, but those of you are attending this conference because it is a course, it's a basic course, because Ajay sir has specifically told us that this is going to be a sex positive summit where it's going to be a basic course. So those of you who do not know about this, for their sake I'm telling, systematic desensitization involves gradual exposure to the feared stimulus, in this case vaginal penetration, combined with relaxation techniques to reduce the anxiety and discomfort. And it involves the use of fingers and later the dilators to gradually desensitize the vaginal area to penetration. This is also supervised by the staff now since the 6th batch. Till then, I myself was doing everything. And mindfulness and breathing exercises is a crux of the treatment. Mindfulness and deep breathing, you know, all of us know, but we don't practice. They stimulate the parasympathetic nervous system, promoting relaxation of the mind and body, and enhances the emotional connection during intimate moments. And medications like antidepressants, anxiolytics, muscle relaxants, nutraceuticals and supplements, local anesthetic gel, PDE5 inhibitors for husband are given as and when needed. For some, they are started even before they come for admission, and for some they are started after they reach. Because many couples, you know, when they have had vaginismus for a few years, maybe for more than 5 years, what happens is the husband also has developed secondary erectile dysfunction. So we start them on PDE5 inhibitors even before they come. And cognitive behavioral therapy and other psychotherapies can help address the underlying psychological causes of vaginismus. It can also help to set new healthy patterns with regards to not only vaginismus but other aspects of the couple relationship also. Because many of us have got unrealistic expectations from the marriage and from our partner. And that is where the crux of the problem lies, you know. So cognitive therapy, if we tell them to go for cognitive behavioral therapy or other therapies for that matters, they won't go. But because now they have come to us with such a problem, we tell them to do this, and so all the other problems also get addressed. And in some cases, such type of therapy started long before admission, and in many cases when we observe that during the admission time they have certain issues which they themselves were not aware of, we advise the couples to continue the therapy for a period of months as is needed after they go home. A balanced diet, including adequate hydration, supports overall physical and emotional health, which is crucial for managing vaginismus. We have a dining hall where up to 20 people can have food together. We encourage the couples to have food together as far as possible, and we encourage them to have vegetarian food with a lot of fiber, because constipation is a big problem, you know. If you have constipation and then if you have dry stools in the rectal area, then fingering, dilators, everything is going to be very difficult. So we encourage them to have healthy vegetarian food together as far as possible, because group discussions happen during that time also, and it improves the unity and also encourages them to motivate and support each other. The feeling that there are so many others who are having similar issues offer a great sense of relief to the couples, because till they come there, they feel that I am the only one who is having this problem. I'm sure that all of you who have had cases of vaginismus must have had patients echo similar feelings, right? So many of our patients feel great relief seeing so many other couples with similar issues. So I do not offer individual couple therapy at all, even if they afford to pay 3 times the amount that is charged for group therapy, because we have realized that group therapy and group sessions and the enlightening interactions that happen is the crux of the treatment. And if in a country like India and also in Kerala, in a small country, if we can manage to do it, then I'm sure that we can do it all over the country. I'm sure, and I request each and every one of you to try to do that. whenever it is possible. See, let us not think that patient will not be able to afford, patient will not be able to get leave. Look, a few months ago, one patient, please give me a couple of minutes. Can I take a couple of minutes, please?
2 minutes.
So, you know what happened? A few months ago, a carpenter and his wife, that is married since 10 years, having vaginismus, they came to me and then they told me that they wanted admission treatment. So, I asked them, look, this treatment costs this much, so will you be able to afford it? So, that patient told me, doctor, who are you to judge whether we can pay or not? We will pay for those things which we feel is important. So, you should not judge. You should not judge anyone. And you are not the person to decide what is important to your client or not. The client is the one to decide. You can only help with the decision. So, we have classes and interactive group sessions. These sessions covering sexuality, sex education, life skills and communication skills and conflict management can foster understanding and improve the relationship dynamics. Discussing and discovering about one's own and the partner's predominant love languages brings in a lot of insight. How many of you know about the 5 love languages? And how many of you practice speaking your partner's love language? We don't. I discovered that only recently. So, I implore all of you to go and read about it and then try to practice your love language and your partner's love language. And we have had experience that group sessions work wonderfully. And just a few more slides. And here are some pictures of positions being demonstrated with the help of male and female dolls. And the male doll has got a penis and the female doll has got a vagina. This was made by one of my couples who successfully completed the treatment. And this is a soul gazing position which I teach all the couples. There are many more, and because of lack of time I am not going into that. And recreational activities can help reduce stress, improve mood and strengthen the bond between partners. So, after they finish their exercise, we allow the couples to go out for movies, outings to temples, churches, etc. So, this is one girl doing Bharatanatyam. She has not danced after her marriage because she was so depressed because of the vaginismus. So, this is the dance which she performed on the 3rd day. And say they go out for walking, they play with blocks, they go to movies and we go to the beach. And I offer hypnotherapy and acupuncture for selected cases, not for everyone. And after the 10th day, shopping for suits, beauty parlor visits, mehendi, etc. are being offered, which helps build up the excitement as the consummation day draws near. It's as if, you know, they are building up towards a second marriage. This marriage they will be able to consummate properly, you know. And then just before we tell them to go ahead and try for penetrative sex, we go to the beach for the beach therapy. The term was coined by one of our patients from the 3rd batch, a doctor. My God, the fun we have here. And I would like to show you a lot of photos, but then due to time restraint, I am not going to show you. Can you identify the person here on the left side corner? Yes? Dr. Neelima. Yeah? She had come there to stay with us for more than 3 weeks to be part of our batch therapy, about a year and a half, you know. And to observe it all, as she was unbelieving that a batch treatment would work for sexual issues, especially in a country like India, where we have so much of taboo and stigma surrounding the word sex. And for sure, the validation I got from her convinced me that I am doing things properly. We also got some valuable insights from her. Thank you very much, dear Neelima. And you are very much a part of our family now. Love you. And here is another picture. You know, this batch couple, the couples who left last week, they wanted to take a picture like this so that I can show in the conference, because none of their faces are seen, you know. And this is another picture. And there are some more clicks from the beach. We encourage the couples to do click pictures in romantic poses. And the couples make us also pose for pictures. Obviously, if my husband tries to lift me up, then that's gone, his back would be gone. So they make us pose like this, you know. And we feel that we have also started to reclaim our intimacy, which, like most couples out there, we had also lost in between. So we have also slowly started to reclaim our intimacy, which is an additional bonus, you know. There is more to achieve, but then we are now on the track, okay? And this is a dinner treat. We give the couples a dinner treat on a way back from the beach. And then finally the D-Day. Many husbands who have never had any erection issues till then start having some difficulty in having erection, and then we both are there, myself and my husband are there to reassure them, and the seniors are also there. They can contact the seniors, they will get reassurance from them. Some are successful in the first attempt and some take a couple of days. We give them the necessary support in the form of counseling, anxiolytics, lubricants, PDE inhibitors, etc. as is needed. We make sure they are successful at least a few times before sending them home. But by that time, no one wants to go home, you know, and find excuses for staying back till the last couple leaves. That's what happens these days. The starting of the batch therapy, which we have officially named as Dr. Sita's batch therapy, has been the game changer. I have never looked back after that. Yes, except to say hi to you all and to show you how far we have come. I'm not saying that it's been an easy journey. There were a lot of challenges and there were a lot of challenging patients too. And I'm sure that we'll get challenging patients in the future too. But now we have a SOP, a standard operating procedure, a very structured program, and we trust the process and tell our patients also to trust the process. I like to think of our program like a carefully made chain or a building block puzzle, and it's my brainchild. But the learning is far from complete. We are learning from each couple and each and every batch, asking for feedback, making whatever modifications we can, trying to gain more knowledge and insights and enjoying it all. Well, not always, but most of the time. Sometimes it is very, very exhausting. Initially, I was the only one who was doing more than 95% of the work, but then slowly my husband, Dr. Ramachandran, started doing just what I requested.
Ma'am.
Just 2 more slides. Now he is very much involved in the entire program and coordinates everything beautifully. He's there in the audience. Thank you, my dear husband. I can't do without your support. Love you lots. Okay. The success we consistently deliver would not be possible without the staunch support and dedication of all our staff, and they are totally kind, compassionate, teach them to do many exercises, do not gossip about any of the patients. I take this opportunity to thank them also. And we are now here waiting to guide all the couples. This picture, one last picture, I especially want to show you all this couple's photo. It's their wish that this be shown in every conference, every seminar I present. They had got hymenectomy done after 3.5 years of marriage and following a 6 years courtship. And they did it from a reputed center in Kerala. After hymenectomy, when the vaginismus could not be cured, they were on the verge of divorce. And then Rao sir, they contacted Rao sir, and Rao sir referred them to me. And now it so happened that the day we told them to go ahead with the penetrative sex, it coincided with their 4th wedding anniversary, and we had a very grand celebration. Yes, baby shower, I'm not going to do this thing. So I believe, friends, that this is my life purpose, this is my calling, and I get such great fulfillment from doing all this. I've completely stopped all my obstetric practice, reduced my regular OP to the bare minimum, focusing only on sexual medicine and some other consultations. Initially, I was taking in just the statistics. Initially, I was taking in only cases of vaginismus. Now we are managing couples with erectile dysfunctions, discrepancy issue, unsatisfactory sexual life also. Here are the statistical data. Maybe we'll discuss it during the lunch break. And yeah, 1 minute, 1 second. Inish. Just this time, sure everyone will love that video. This is these scripts. Next one.
Thank you so much, madam. Thank you so much. Thank you for that beautiful 20 minutes. There won't be any questions. And I think it will be nice to call up the sir also.
Big applause for the ma'am.
Ma'am, can you call the sir also?
Huh?
Can you call the sir to the dais? if
Yeah,
he is here?
please come.
And
See, while sir is coming, please play this video also. That beach.
boss in lunch time, please.
That video. That last video, please.
Ma'am.
Not only from Kerala, now people are... अरे आप लोग नहीं ट्वीट कर रहे शायद.
Most welcome, sir.
But now people from other parts of the country are also
And
starting to
I
come.
request our chairpersons to kindly felicitate Dr. Sita ma'am and sir.
And this is my husband, Dr. Ramachandran.
Ma'am, एक बार ये ले लो ना. Mic, your mic.
I wish I had more time, but what to do?
So really eye-opening sessions for everyone. जिनको ऐसा लगता है कि सेक्सुअल प्रैक्टिस अभी अपने बॉन्ड स्टेप में है. आई थिंक देयर आर लॉट ऑफ थिंग्स वी हैव टू लर्न.